In one of the largest ever murder cases against a healthcare professional, a former doctor in Ohio is accused in the overdose killings of more than 24 patients. William Husel pleaded not guilty yesterday to 25 counts of murder. CTM investigative correspondent Anna Werner is following the case. Anna, how far back did these allegations go?
Well, Tony, the criminal investigation has been going on for about 6 months now. Husel was fired by his Columbus area hospital in December. Prosecutors say he gave excessive amounts of painkillers to the patients over the course of 3 years, hastening the deaths of some, possibly causing the deaths of others.
I'm just kind of numb to him right now and what happened and what he did to my mom.
Prosecutors say Amy Pfaff's mother, Beverly Schertzinger, could have improved with proper medical treatment. But they say she died after her doctor, William Husel, prescribed a fatal dose of the powerful painkiller fentanyl.
The fact that he gave it to one patient and then gave it to another, and it's upsetting.
Husel is charged in the overdose deaths of 25 patients between 2015 and 2018. According to investigators, he ordered doses that were between 10 and 40 times greater than deemed medically appropriate. He allegedly told many family members the same story he told Christine Allison, whose husband Troy was in a truck accident. She says Husel told her,
"Oh, no, he's dying. I'm 99.9% sure he is brain dead."
In February, we spoke with Allison and other family members who lost loved ones under Husel's care. Allison says her husband was dead 3 hours after getting to the hospital.
After it was over, we go down the parking garage. I looked at my daughter and I said, "What the just happened?" And she's like, "Mom, I have no clue."
The charges form one of the biggest murder cases ever brought against a U.S. healthcare professional.
This breach of a doctor's oath is vile and worthy of today's actions, and that begins the process of holding this accused killer criminally accountable.
But Husel's attorney says his client never intended to speed up any patient's death.
I think it's important that everyone watching this understand that the patients that we're talking about are end-of-life patients. We're going to die, whether Dr. Husel was on or whether another doctor was on.
The hospital involved, Mount Carmel Health System, tipped off the authorities here to Husel's actions after they conducted their own internal investigation. They continue to cooperate with law enforcement. Employees who helped administer the drugs are no longer treating patients. No other charges have been filed in this case. But it's worth noting that prosecutors credited the family members with helping them with their investigation. If you can imagine being a family member who lost someone, well, you have to tell the investigators what happened. What did Husel say? What did you do? What did you say back?
Did he tell family members the same thing?
It's interesting. When we interviewed the family members a few months ago, that was striking to me that many of them said, they told us that he told us that our loved one was brain dead. And we couldn't understand how suddenly they were brain dead so quickly.
Yeah, and the big question is always why?
Why?
Exactly.
Unknown.
And
They haven't said the motive. Prosecutors said they don't know.
Anna, thank you. We'll continue to follow this story.